People often ask, are there any alternative treatments for Moyamoya other than surgery? Certainly there are a number of medical treatments we try to offer in the time between when the diagnosis is made and when we ultimately go to surgery. One of the concerns with Moyamoya is there's not enough blood getting from the heart up into the brain because these blood vessels are narrowed. And so some of the alternative treatments we can use, both in the short term and in the long term, are efforts to maximize blood flow to the brain. Those include using medicines that will thin the blood a little bit so they can squeak through these rather narrow pipes, essentially, without getting clotted or scabbed off. Aspirin is a tool that we use quite a bit because aspirin helps blood to be thinned a little bit, and that gets the blood from where it's needed in the heart, from where it starts in the heart to where it's needed in the brain. Similarly, we try to keep kids well hydrated because if we have more water in the pipes, essentially, that will increase water pressure and prevent the risk of strokes. So hydration and aspirin use are two tools we use medically to help keep the kids safe during the time prior to their surgery, and in fact we use that after surgery as well. Many of these kids will stay on lifelong aspirin therapy. There are other types of blood thinning medicines that we sometimes use, heparin, Lovenox, Coumadin, for example. But ultimately, whatever medical therapies are employed, a lot of the data would suggest that the real treatment for Moyamoya is surgical. And once the diagnosis of Moyamoya has been made, the real key is to get the child to the hospital to be seen in consultation and ultimately have a surgical treatment that will definitively fix the disease.